Currently, there are 2,193 people who have recovered. So it's a very, very positive outcome for our community here in New South Wales. There are still 203 people who are receiving care for their COVID-19. Some of those are obviously in our hospitals, and some are in their homes and other facilities being managed by New South Wales Health. And again, I want to thank the New South Wales Health staff for all the amazing work you've done. Total negative cases, total negative tests. Thus far, we've had 190,262 negative tests, and that's fantastic. That's of a total number of cases of 193,000 test cases for 193,256. In the last 24 hours, remember the day before we had an incredible number of 7,352 cases that had been tested. People had been tested, not cases, people have been tested. In the last 24 hours up until 8 p.m, that's fallen back to 4,840. Having said that, it's still quite a remarkable number, 5,000, or close to 5,000. I'd like to make this very, very clear to all of our residents here in New South Wales, and that is, if you have any symptoms whatsoever, it could be as little as an itchy throat, a slight runny nose, temperature. We want you, New South Wales Health, the government wants you to come forward and be tested. The Premier's made the point on a number of occasions in the last few days that New South Wales is desperate to get much more testing done. We need it to understand what's happening in the broader population. So this was a different message, of course, to earlier on, because earlier on, going back now nearly 3 months, we had not as much in the way of testing equipment, reagents. That was a problem right around the country, but we've managed to access the necessary testing equipment. And certainly a strong message to everybody is, feeling anything at all, even if you think it's the most mild of symptoms, please go along to your GP if your GP is open, but if not, go along to one of our COVID clinics, or go along to the emergency department if you happen to be in an area where there are no COVID clinics, and be tested. Don't be nervous about it, don't be hesitant about it. We really would welcome you to come and have that test. There has sadly been another death up until 8 p.m. last night, and that was a 96-year-old lady who passed away at the Anglicare Newmarch facility. And to the family of that lady, I just want to express, I'm sure, all of the community's condolences. It's tough whenever you lose a family member, mum in this case, and just ask that we all think about that lady's family today on what is a solemn day of remembrance. At Anglicare Newmarch, we've also had 4 new cases. There are 2 residents and 2 staff that have tested positive. That brings us to a total of 48 cases at Newmarch. There are 17 staff and 31 residents. I think that's a reminder to us all, again, strong message from the government and from our community to every one of us is, if you're not feeling well, don't go to work. Please don't go to work. Doesn't matter how minor it is. An itchy throat, as I said, any minor symptoms, just don't go to work. Because unfortunately this virus, one, we know it can be a deadly virus, but it's also a very cagey and sneaky virus. It can catch us when we least expect it. So please, please, go and get tested and don't go to work. Do not go to work. There has been another worker in an aged care facility who has, within 48 hours of working, had some symptoms. Now, normally we would say in most situations that if it comes on within 24 hours we'd be concerned, but for particularly vulnerable populations such as aged care facilities. If someone has symptoms even within 48 hours, well, that is it's a trigger. It's a trigger for New South Wales Health and, of course, our federal government colleagues to implement what is necessary in terms of the tracing. I'd like at some point to be able to be open and transparent with the community about that particular facility. But at this stage, I don't think it's appropriate to name the facility, having in mind that the families and the staff have yet to be notified. So, as I'm sure you all appreciate here, many of you have been to many of these conferences, this COVID-19 is very much it's a rolling situation, and we just happen to be at the point where the families at this point have not been notified, and nor other staff, so it's not appropriate to make that public. But we will, the government will certainly make that, New South Wales Health will certainly make that public once we've been through that. And I'll ask Dr McAnulty to make some more general comments, perhaps about the 48-hour issue, and just why that is something which is a trigger for us to be making all the necessary investigations. The beaches and the efforts by some councils to open up to the beaches to allow exercise and swimming, generally, surfing. I have to express as New South Wales Health Minister a degree of disappointment and agitation about the fact that some people, when the rules are relaxed, when we try and do the right thing by giving people an opportunity to have some outside exercise, that people are disregarding the very strong message of social distancing. You know, New South Wales, indeed Australia, but particularly New South Wales, we're the biggest jurisdiction in this country. We've had by far the most cases, but we've also had by far the most people coming in from overseas. We are the gateway to Australia. We know that, but we also know that there is a degree of transmission. Most of the cases may well have come from outside, but there is still a degree of transmission between people. And that's why we keep saying, keep your 1.5 metre social distance. It's a pretty simple message. And that message is actually going to be here for a long while, and will be here until we can get a vaccine, or until it perhaps somehow ends up more broadly across the community, although we don't expect that to happen because we've done such a good job at this stage